Hi, my name is Brooke, and today I'll be showing you how to assess the eye. So we have an eye right here, and the clear front window of the eye is called the cornea. And then your iris is the colored part of the eye, which helps regulate the light amount that comes in. The pupil is the circle dark part that allows the light to go to the back of the eye. And the lens is transparent, so you will not be able to see it. And the retina is the nerve layer that lines the back. That lines the back of the eye, and it changes and creates electrical impulses to travel through the optic nerve to the brain, so around the area here. And then we have the optic nerve, which connects the brain and carries electrical impulse. And the optic disc would be like a dark kind of colored into the back. It's the red veins that will go to the back of the eye. And the vitreous is the clear jelly-like substance that fills up your eye. And this is the first visual test that a doctor would ask you to do, which is the visual acuity test, and it determines how well you see letters across the room. Some may know it as the letter test, but the correct enunciation is the Snellen chart. You must stand 10 feet back from it, and I'll ask you to read the lowest line possible.
F-E-C-F-D.
This is the second test, and it's a refraction test, and it's to determine if you need glasses. It's a mask-like device, as you can see, so it has like a little headrest so your head doesn't hurt. And it contains wheels on the side, which has lenses inside that are different strengths to help you judge what your vision is. And the second test I have is a manual visual field test, and it's to look at a testing screen, and it blinks a red light on and off, and you have to press a button to see how fast your reaction is and the gaps in it, but we don't have that. And so then the next thing I'm going to do is shine a light into my patient's eye to see if her pupil retracts or not. So how her pupils are, there we go. Her pupil is big right now, and then when the light gets flashed on it, it turns small. And then you just ask them to look left to right. Eye exams are done to correct your vision and or make your vision adapt so when you get older. So when you're 5 and younger, they do eye exams to see if you have a lazy eye or if you're cross-eyed. And when you're older and you're in your teenager ages, you get eye exams in like 3 to 4 years, but then if you have eye problems, the doctor will set appointments up for you to get your eye exams. And when you're an adult, if you have really bad eyes, you should get them every 2 years or when told so. So some questions that the doctor will ask once you get your eye exam or before is that, have you had any family history of bad eyes? Do you have diabetes, or did someone in your family have diabetes? And if you're a premature baby, or if you were born a premature baby, and if you're taking any medication that could mess with your eye vision. Some normal results of your eye test would be 20/20 vision, good peripheral vision, ability to identify colors, and no disease starting. So when we look for it, we're looking to catch the disease before it can start. And that's how you assess the eye.